Since you've already been diagnosed with Crohn's, you probably know about quite a few of the symptoms of this disease from personal experience. But it's worth going over them anyway, since Crohn's affects people in many different ways. Because it's an unpredictable disease, you may experience new symptoms when your disease flares up. So, here we go. The symptoms and complications caused by Crohn's will change depending on what part of your intestinal tract is inflamed. On top of that, your symptoms will range from mild to severe. The most common symptoms of Crohn's disease include fatigue, diarrhea, abdominal pain, fever, night sweats, and occasional rectal bleeding. Some patients will also experience symptoms beyond the gut, including back or joint discomfort, especially when the disease is active, and may even develop a rash or eye inflammation. These symptoms are different for each person and can change over time. You may even lose your appetite and lose some weight. And because Crohn's can reduce the ability of your GI tract to absorb nutrients from the food you eat, there's even a risk you could become malnourished. One of the most common complications from Crohn's is a narrowing of the intestine due to scarring and inflammation, which can lead to a partial blockage in your gut. When this happens, people experience constipation, bloating, cramping, and sometimes vomiting. For children with the disease, there are other areas of concern, such as a delay in growth or sexual development. Well, that pretty much covers the early, fairly common signs and symptoms of Crohn's. There are others that may occur if your disease progresses, which are included in the subsection called More Severe Crohn's, More Severe Symptoms. I recommend that you watch this subsection when you're ready to deal with more information on the possible physical challenges you may face in the future. Though you may not experience any of these more severe symptoms, it's helpful for you to know about them so that you can understand them better if they begin to occur. What's next?